let's just jump right in. Picture this. You're out and about, and suddenly you're in a situation where every single second counts. Would you know what to do? Today, we're going to talk about how to react in a medical emergency, how to turn a moment of fear into one of life-saving action. So, let me ask you this, and be honest with yourself. In a real emergency, do you think you'd panic, or would you act? It's a tough question for sure, but the answer almost always comes down to one single thing: how prepared you are. And that really brings us to this critical fork in the road that everyone faces in a crisis: panic versus preparedness. And you know what? The choice you make isn't actually decided in that high-pressure moment. It's decided long before an emergency ever happens. I mean, think about it. On one side, you've got panic. It's that heart-pounding, overwhelming feeling, and it's totally fueled by not knowing what to do. But on the other side, that's preparedness. And that's what gives you control. It gives you a focused mindset to actually deal with what's happening. So the big question is, how do we get from that panicked state to a prepared one? Well, the answer is pretty straightforward. It's all about understanding the real goal of first aid. It's our game plan for when things go wrong. First aid is, well, it's exactly what it sounds like, right? It's the very first help you give somebody. Look, you're not expected to be a doctor or a paramedic. Your role is to be the bridge between what happened and when the professionals show up. That immediate care you give, that can literally change everything. And first aid is really guided by 3 simple goals. First, you want to preserve life. That's number 1. Second, you want to prevent the situation from getting any worse. And third, you want to help promote their recovery. I like to call them the 3 Ps: preserve, prevent, and promote. Every single thing you do should line up with one of those goals. Okay, so enough with the theory, let's get practical. Because when it really comes down to it, it's action that saves lives. So let's walk through one of the most serious things you might ever have to deal with: finding someone who's unconscious. Now, before you do anything else, and I mean anything, your absolute number 1 priority is safety, your own safety. You can't help anybody if you become a victim yourself. So just stop, take a breath, look around you, and check out the scene. Are there any hazards? We talking traffic, fire, maybe some downed power lines? Make sure the area is safe for you before you even think about approaching that person. All right, let's walk through these crucial steps one by one. Really lock these in. First, check for a response. Tap their shoulder pretty firmly and shout loud and clear, "Are you okay? Can you hear me?" If you get nothing back, step 2. You have to call for help immediately. Get those professionals on their way. Third, open their airway. All you do is gently tilt their head back and lift their chin. This is so important because it pulls their tongue away from the back of their throat and clears the way for air. Fourth, check if they're breathing. Lean down close to their mouth, look for their chest moving, listen for breath sounds, and try to feel their breath on your cheek. Don't do this for more than 10 seconds. And finally, if they are not breathing normally, or maybe they're just making weird gasping sounds, you've got to begin CPR. Start those chest compressions right away. This is the most critical call you will ever make. The second you realize someone isn't responding, you get on the phone and call for emergency help. Now, for a lot of us, that's 911, but make sure you know the right number for your location. And when you call, give the operator your exact location and be really clear about what's going on. So, you've made the call, you've started the first steps. What now? Well, your job isn't over, not by a long shot. Right now, you are a vital link in what we call the chain of survival, and you hold that link until the pros take over. And please remember this. You are not alone in this moment. Even if you're thinking, "I don't know what to do, I'm not trained for this," the emergency operator on the other end of that phone is your coach. They will talk you through exactly what to do, step by step. They'll even tell you how to do chest compressions. Never ever let a lack of confidence stop you from acting. So, we've covered the mindset you need to get past that initial panic, and we've gone through the practical steps to take action. We've seen that being prepared is absolutely the key. So we're going to end right where we started, with that same question. But now you've got the tools to answer it. Are you ready to be the one who acts?